Hi, everyone. Thank you for coming. I'm Dr. Balu from the Silm Mental Health Center. I'm here tonight just to introduce our speaker for tonight. Tonight we'll be hearing from Karima Hassam about sleep and mental health. She's been an occupational therapist for 13 years and seen a lot around sleep. So she's going to help us connect some of those dots tonight. Just a couple housekeeping things. In terms of leaving your camera or your audio on, feel free to do whatever your camera on, feel free to do whatever you like. We are recording tonight's session, but we won't be able to see any of your pictures. So if you're comfortable to have your camera on, please do. If you don't want to have it on, that's completely up to you. We'll have the topic discussed first, and then at the end, I'd love to have some questions from you all. You can put in the chat box, and then I will share those with Karima, and we'll hope to answer all of your questions. So why don't we get started? Karima, I will pass it over to you.
Thank you. Hi, everyone. Thank you for joining today. I'm Karima Hassam. I'm one of the therapists at the Silm Center for Mental Health. So thank you again for coming. And so our topic for today is sleep and how it affects our mental health. I personally chose this topic because it was something that I've struggled with personally and felt that it was important for me to learn a little bit more about how to improve my sleep, just to improve quality of life and mental health. So I do hope that you find it as interesting as I did. Okay. So here's an overview of what we will be discussing today. So I will provide an overview on the nature of sleep, what determines good sleep, and then we will look at the impact of poor sleep and how that can impact our mental health and our well-being. And then finally, we will talk about some strategies on how to improve our sleep hygiene and our sleep. So what determines good sleep? What is good sleep? As we know, we all need sleep. We also know the impact of poor sleep and how that impacts our day-to-day functioning. So sleep is an essential activity for vitality and optimal health. It plays an essential role in our brain and body functions, including our metabolism, regulation of our appetite, proper functioning of our systems, our immune system, cardiac system, the various hormones in our body. So it's safe to say that if a person suffers from poor sleep, their well-being is probably impacted. So what is sleep? As we all know, sleep is a period of reduced activity. So for humans, sleep has some distinct characteristics. So we may assume a familiar position, such as lying down, putting on a blanket, closing our eyes, and we're less responsive to external stimuli around us. Sleep is a state which is easily reversible, and that's something that differentiates it from other states of decreased consciousness. So for example, being in a coma or animals that are hibernating. There's many physiological changes that occur when we're sleeping. When we're awake, our body's demands for temperature, blood pressure, oxygen, all of those can vary. So depending on what we're doing, if we're exercising, if we're sitting down, if we're eating a meal, many of those demands vary according to the needs of our body. However, when we're sleeping, many of these functions are reduced. So they can be quite regular when we're in certain phases of our sleep cycle. So many years ago, it was believed that there was not much brain activity that occurred during sleep. However, we now know that this is not the case. So we know that many chemicals involved in the brain are involved in our sleep cycle. So neurons in the brain, such as serotonin, norepinephrine, can help to keep our brains active during periods of wakefulness. And neurons in the brainstem can help bring us into a sleepy state by turning off the very chemicals that keep us awake. So similar to physiological functions, brain wave patterns can be variable in the day and then much more coordinated at night during certain sleep phases. So despite these critical functions, there's approximately 70 million people in the US, 45 million people in Europe that suffer from a sleep disturbance or a sleep disorder, which can affect our overall health and function. A study by Schlarb and colleagues in 2012 report that healthy women normally report better sleep quality than males. However, it should also be noted that women suffer from more sleep-related issues compared to males. So looking at this infographic, we can see how much sleep we need. But first, we'll talk about why we need sleep. So why do we need sleep? So at different phases, different ages, we need sleep for various reasons. So for example, growth. In children, Sleep supports our growth. So our body increases production of proteins, which we need for cell growth and to repair damage. Nervous system function. So a lack of sleep can affect our memory, our performance, our ability to think clearly. So if you're severely sleep deprived, you may even experience neurological issues like mood swings, hallucinations, and other negative side effects. We need sleep for survival. So researchers don't quite understand why sleep is so essential, but many studies have shown that animals that are sleep deprived, specifically with REM sleep, can have shorter lifespans. So in addition, a lack of sleep can also compromise our immune system, which can then increase our risk of illness and shorten life. And most importantly, arguably, is well-being. So people who don't get enough sleep are at higher risk of developing various health conditions, obesity, diabetes, and various other health problems. So looking at the picture on the screen here, you can see how much sleep you need. So for humans, it's generally determined by age. So as you can see, when we're younger, we definitely need more sleep. So newborns need about 17 hours a night. Young children might need about 15 hours. Older children, teenagers require about 10 hours a night. And as we enter our adult and older adult ages, our sleep requirements are generally about 7 to 9 hours a night. Of course, other factors can play a role in how much sleep you need per night. So for example, being pregnant or recovering from an illness or accident can definitely change your sleep needs that you need on a daily basis. Another study by Medic and colleagues in 2017 reported that in a study of 135 healthy children who showed diminished scores on a neurological test were linked with having sleep problems. So the parents of these children also reported that they had more behavioral problems than those children who had healthier sleep patterns. Children who are sleep deprived can also have other psychological issues, poor social functioning, externalization of symptoms, self-harm behaviors, and other psychosocial negative consequences. In adolescence, sleep problems can have a negative effect on school performance. It may increase their chances of engaging in risky behavior, such as substance use, driving under the influence, unprotected sex. It may lead to the onset of other mental health issues, such as increased feelings of loneliness or worry or anxiety, and can lead to depression. So when we don't meet our sleep needs, there can be a range of impact on our minds and our bodies. Poor sleep can impact the way that we think, so the way that we pay attention, our vigilance, our functioning, the way we respond to our emotions, the way we form memories, make decisions. It can increase our chance of engaging in risky behavior and poor judgment. So as we just saw on the screen before, we see that our sleep needs do vary with age, and they can fluctuate based on the events in our lives. So how do you know if you're getting good sleep? So just looking at the list on the screen here, try to take a mental note of whether you are following some of these categories that determine good sleep. So do you fall asleep in 30 minutes or less? If it takes you longer than a half an hour to fall asleep at night, it can be for one of two reasons. Either you're going to bed too early for your internal clock when you're not physically ready or mentally ready to sleep, or you're engaging in activities that may be too stimulating for bed. Do you wake up for 5 minutes or longer, no more than once a night? So for adults that are over 65, twice a night is considered appropriate as well. But if you wake up a few times and you roll over in your bed and you go back to sleep, that's considered to be normal. But if this happens several times and you're not falling back asleep, it might be something that you want to put a little more thought to as to why it's occurring. Do you fall back asleep within 20 minutes of waking? Again, for older adults over 65, about 30 minutes is considered normal. We usually have a period of about 10 to 15 minutes after we wake up when our body is calm and relaxed. Once you hit the point where you realize you're not going back to sleep, it can trigger a whole cascade of feeling more awake and alert in our bodies and make it more difficult for us to fall back asleep. When you hit the 20-minute mark and you haven't fallen back asleep, it's suggested to do something relaxing, such as coloring, reading a book, doing some light stretching, not something stimulating like watching television or using the computer. But this distraction of doing something light might just be what your brain needs to get it back into the mode of getting back into sleep. are you asleep 85% of the time that you spend in bed? So it's a good overall reminder that the bedroom should be used for sleeping or sex. So try to minimize the use of your bed for other activities such as eating, doing your work, using your phone, or anything that is not sleep related. So when we don't sleep for several days, we might fall into something called a sleep debt. This was kind of an interesting term. So if you haven't slept well or long enough for a few days, you would create a sleep debt. Once your debt builds up, you might feel physically and mentally exhausted. So try to make sure that you get enough sleep to avoid creating this debt. You can't necessarily make up this debt. So for example, we might think, I didn't sleep as well all week because I was so busy with work. I'm going to catch up on my sleep on the weekend. It doesn't necessarily work like that. You may not be able to restore your body back to the consequences of having poor sleep during the week. So it's something to be aware of. So we might think, can we adapt to needing less sleep? Some people might say, oh, I can function on 4 to 5 hours of sleep. So we may think we can, but generally most people do have some negative effects. So for example, it will still impact your function in some way. So it can harm your judgment, your reaction time, the way that you process information, the way that you process emotions. Something may be impacted if you're really not meeting those sleep requirements for a long period of time. So what are the consequences when we don't sleep well? There are, of course, many reasons and opportunities in our lives where our sleep habits do drift from the optimal guidelines that we just saw. There can be lifestyle factors such as excessive caffeine use or alcohol use, working on a job that requires you to work on shift work, environmental exposure such as exposure to nighttime pollution or not enough daylight exposure to light, and various lifestyle circumstances. So for example, being a parent to a young child, being a caregiver to somebody, having an illness or having been in an accident can certainly impact our sleep needs. So some of the consequences of poor sleep. So definitely there are short-term and long-term consequences. Some of the short-term consequences include increased stress responses, somatic issues such as pain in our body or muscle aches, decrease in our quality of life, emotional distress, so difficulty regulating the feelings that we might have, mood disorders, cognitive issues such as difficulty with memory, attention, or performance. And when we don't sleep for a longer period of time, we may be at risk for some of the more long-term consequences, such as increase in physical health issues, such as increase in hypertension, risk of elevated fat levels in our body, cardiovascular disease, difficulty managing a healthy weight. Poor sleep can also aggravate GI disorders that we might have. It may increase the risk of various cancers and ultimately increase our risk for an earlier mortality. It was interesting to note that there are approximately 100 classified sleep disorders. However, most of them do occur in one of three ways. So either sleep deprivation, sleep disruption, or events which occur during sleep. So that, for example, would be something like sleep apnea or restless leg syndrome. So continuing on with some of the consequences of poor sleep. So in a nutshell, sleep deprivation is caused by a consistent lack of sleep or reduced quality of sleep. So getting less than 7 hours of sleep on a regular basis can eventually lead to health consequences that can affect your entire body. So this can be caused by an underlying sleep disorder. So how do you know if your sleep is poor? What is sleep deprivation? So looking at this list, when you're sleep deprived, you're not getting the total amount of sleep that you need. So some of the signs include falling asleep within a few minutes of lying down, feeling drowsy during the day, nodding off from micro sleeps. So micro sleeps are periods during the day when you're otherwise awake where you find yourself nodding off. So for example, if you're in a meeting at work and you find that you fall asleep for a minute, or something more dangerous would be if you're driving and if you're at a red light, you may find that you fall asleep for a few seconds while your car is stopped. Stimulants such as caffeine are not enough to override your body's need for sleep. In fact, some of these can make your sleep deprivation worse by making it harder to fall asleep at night. And this can lead to a cycle of nighttime insomnia, followed by daytime use of these stimulants, which can ultimately even worsen the amount of sleep that you do get. So looking at this picture, again, sort of summarizes some of the impact that sleep deprivation can have on our body. So for example, looking at your heart, irregular heart rate, increasing your risk of heart disease. At our musculoskeletal system, we can have muscle aches and pains, muscle tremors, decreased reaction time to stimuli. It can suppress our growth, decrease our temperature regulation, increase our risk of obesity, increase our risk of diabetes, and it can impact our immune system. So our immune system is important for fighting off bacteria, viruses, illnesses. So when this is not functioning well due to poor sleep and not having these hormones regulated, we can then impact our ability to fight off infection and taking it longer for recovering from illness. And then when we look at our brain, it can impact our cognitive functioning. It can involve memory lapses, losses in judgment, severe yawning, hallucinations, and can lead to the development of mental health issues. So why can't we sleep? If you ever think about the reasons why a person can't sleep, I thought this was interesting because it shows that one of the main reasons why individuals cannot sleep can be due to overthinking. So this really highlights the impact of sleep and mental health. So for example, if you think about during the day, you're very distracted with, your work or school or children or your partner, socializing or exercising, engaging in the activities that you do day to day. And it's not until you actually lie down to sleep when you actually think about or are more aware of the thoughts that are in your mind. And when some of these thoughts are negative or dysfunctional, you may have a hard time controlling them, and that can prevent you from being able to fall asleep. So other reasons for poor sleep could include workplace stress, excessive use of stimulants such as caffeine, having to go to the bathroom, or other medical reasons. When we don't sleep well due to overthinking, which we just saw on the other slide, it can put us into this negative cycle. So for example, feeling very worried or stressed out can lead to us not being able to fall asleep. That can cause us to feel more tired during the day and make it more difficult to cope with daily activities and daily life stresses. And this might lead to a low self-esteem, decreased self-confidence or self-worth. And that can ultimately lead to more feelings of worry and stress, and thus perpetuating this sleep deprivation cycle. So if you're having sleep problems, you might be more likely to feel anxious, depressed, suicidal. You may be more likely to have psychotic episodes. It can trigger mania, psychosis, paranoia. It can make any existing symptoms worse. It may cause you to feel lonely or isolated. For example, if you don't have the energy in the day to see people or engage with other social activities, others may not quite understand why you can't make the time to spend with them. You may have trouble concentrating or making plans or decisions. You may be more irritable, not have the energy to do your day-to-day activities. You may have problems in day-to-day life. So for example, at work, with family or friends. And you may be more affected by other health problems, including other mental health and physical health issues. So how can we help get better sleep? So I'm not sure if any of you have heard of the term sleep hygiene. We've definitely heard of the term hygiene and physical hygiene, which are some things that we can do physically to take care of ourselves, such as taking a shower, brushing our teeth, and grooming. So if we think of sleep needs, we have the term sleep hygiene. So these are behaviors that we can do to help promote good sleep using behavioral techniques. So forming good habits can help to promote overall well-being and good physical and mental health. It's important to know that on the flip side, if we engage in negative behaviors, those can also impact our sleep hygiene because they're routine behaviors that we do every day. So for example, scrolling on your phone before bed, or watching television or playing a video game before bed can also negatively impact your sleep hygiene. So we want to look at our sleep hygiene and find behaviors that we can introduce to help promote better sleep and also help break habits that are leading to sleep deprivation. So be aware of your sleep hygiene. Think about the things that you do before bed. What is the routine that you engage in? and try and see where you may be able to make some changes. So what determines good sleep hygiene? So having a fixed wake up time. So regardless of whether it's a weekday or a weekend, it's always optimal to wake up at the same time, since fluctuating on a schedule can prevent your body from getting into a rhythm of proper sleep. It's also important to prioritize sleep. So if you think about it, how many times do we sacrifice our sleep for social engagement or to do work or to watch television or to exercise? But it's vital to treat sleep as a priority. So calculating your targeted bedtime based on the wake time that you want can help you to best be ready for bed. Don't overdo it with your naps. So some of us may have situations where we may have to take a nap during the days. For example, being home with a child that doesn't sleep at night may cause you to want to sleep more during the day. So it can be an easy way to regain some energy, but it can definitely throw off your sleeping at night. So to avoid this, try to limit your naps to a short amount of time and earlier in the afternoon so it doesn't impact your nighttime sleep. Following a nightly routine is also important. So following the same steps each night, so putting on your pajamas, brushing your teeth, maybe listening to a podcast, doing some relaxation activities can reinforce your body and tell your body and your brain that it's time for bed. So budget about 30 minutes or so for winding down. So knowing that it's time for bed, engage in some of those routines and rituals about 30 minutes before bed. So really prioritizing that time that you need to prep your body for bed. Dimming your lights can also help to promote better sleep. Try to stay away from bright lights because they can hinder the production of melatonin, which is a hormone that your body creates to facilitate sleep. Unplug from electronics, which is certainly a hard one for many of us, I'm sure. Try to build in a 30 to 60-minute buffer time before bed that is device-free. So no cell phones or tablets or laptops. These can cause mental stimulation that can be hard to shut off and also generate a blue light that can be an hindrance to melatonin production. The other thing you can do is try methods of relaxation. So try, instead of falling asleep being your goal, try to make your goal relaxation. So meditation activities, mindfulness-based activities, breathing activities can also help to promote better sleep. Try not to toss and turn. So it helps to have a healthy mental connection between being in bed and being asleep. So for that reason, if you find that after 20 minutes, you're still not asleep, try to get up, do some light stretching, maybe coloring, nothing too stimulating, and then try again. So this picture just shows some other strategies that you can incorporate into your sleep hygiene. So we talked about developing a ritual of going to sleep, try to sleep in silence and in the dark. So really think about the environment that you're sleeping in. What does your bedroom look like? Is your bed comfortable? Is the temperature okay for you? Is my blanket okay? Trying not to eat too much before going to bed, avoiding smoking and alcohol use before bed, trying to take a walk if that helps you relax or get some fresh air, reducing the amount of caffeine or alcohol, going to bed and waking up at the same time, regardless of the day, and of course, putting our devices away. And then if we look at the top left of the screen, try not to focus on the insomnia. And this is where, you may want to try some of the other techniques such as meditation or mindfulness-based activities to really help better control some negative thoughts that we might have while we're sleeping or trying to sleep. So what are some aids for better sleep? So there are some things that we might be able to incorporate into our sleep hygiene and our sleep routine. So herbal teas, for example, may help. Chamomile tea, for example, can help decrease inflammation and calm anxiety. It contains antioxidants, which can help initiate sleep. Lemon balm can increase levels in your brain of GABA, which may help have a more sedative effect and put you into a more relaxive state. Aromatherapy, so some essential oils may help to, again, put us in a more relaxed state. Lavender can help, heighten our peripheral nervous system responses, which include lowering our heart rate, lowering our movement, and put us into a more relaxed state. Other oils might signal release of serotonin or endorphins to produce a more calming and relaxed response. Some people may want to try some supplements. So for example, magnesium or melatonin, again, can help put us in a more relaxed state and increase production of brain chemicals that can put us into a better place to promote sleep. A weighted blanket. This is a blanket that is quite heavy and can trigger more of a calming and relaxed nervous system response. So it's important to know that some of these aids do have mixed research, but the key takeaway point is to really try and see what works best for you. Do your research, see what works, and it is an individualized plan for yourself. So what works for someone may not work for someone else. Some other things that you may want to try. So when we look at some of the more tips for relaxation and helping us to put us in a more relaxed state, could be breathing exercises. So there's different breathing techniques which you may want to try. For example, there's a 4-7-8 breathing technique, which involves breathing out through your mouth, closing your mouth, breathing in through your nose and counting to 4, holding your breath, counting to 7, and then again, breathing out through your mouth and counting to 8. There's a box breathing technique, which is similar, where you will hold your breath for 4 seconds, breathe out for 4 seconds, wait for 4 seconds, and then repeat. And you can do this while visualizing breathing into the 4 corners of a box. And then there's nostril breathing, which is a yoga technique of a more controlled breathing technique. But the idea here is that any of these breathing exercises can help put you in a better state of relaxation and help get you in that mode of wanting to fall asleep. When we think about that picture that showed that one of the largest reasons why people can't sleep is overthinking, this is where sleep meditation may be something that you want to consider. So meditation can help train us to be less in our head and more in the present moment. So the mind's tendencies to get caught up in thoughts is perhaps the strongest at bedtime, as I mentioned a few minutes ago. So when we suddenly stop and are still, that's when we may be more aware of our thoughts. So meditation for sleep is a very specific guided experience that can offer a natural sleep aid. It can allow us to sort of let go of the things that happened in the day, everything that's happening, and everything that we may fear will happen. And so that we can really rest the mind and the body. So as we know, healthy sleep has more to do with quality of rest than the quantity of hours. So sleep meditations can create the inner conditions in our body and our mind for a restful sleep. So when we settle the mind, we're more likely to settle the body. And it's the state of relaxation and restfulness that makes it easier to wind down and drift off. So when we meditate, it can lower our heart rate by igniting parasympathetic responses, encourage slower breathing, and thereby increasing your chance of getting a better quality sleep. Progressive muscle relaxation is another technique which involves a more controlled method of tensing and relaxing of muscle groups. So some of the benefits of progressive muscle relaxation can include decreased muscle tension, decreased anxiety, lowering our blood pressure, and lowering overall fatigue. So in summary, it's important to know, as we do know, that we all need sleep as human beings. Good sleep involves quality, not just the quantity of our sleep. And poor sleep can lead to detrimental consequences for both our mental and our physical health. The good news is that we can change our ways by making some changes to our sleep hygiene, engaging in behaviors and rituals that can put us in a better place for a better quality sleep. So thank you very much. And if you do have any questions, feel free to type them in the chat.
Thanks so much, Karima. Let's see if we have any questions coming up. No, I have a few. Okay, I've got a couple questions here. So I've heard that alcohol can help with sleep. Do you know anything about that?
That it can help with sleep?
Mm-hmm.
No, I didn't come across any of that in my research, but we can certainly, if there's something that I'm not aware of, we can certainly post and maybe send it out on our website. I'm not sure what the person was referring to specifically, but I didn't come across any of that in my research.
Okay. The second question is, sometimes I procrastinate with going to sleep. I know I'm tired, but I just can't get myself to bed. Any tips?
I think this does go back to the concept of sleep hygiene and really breaking those negative patterns. So it's important to know that sleep hygiene is, any behaviors that we can engage in that can promote better sleep. But it's also important to know that we might be engaging in behaviors that are negatively impacting our sleep. And so really think about what it is that's causing you to procrastinate. What are some of the reasons? What are the behaviors that you're doing? And really try to think about what behaviors can you interject in there to sort of, negate some of those behaviors that are causing you to procrastinate. But I think with any sort of change in a routine or a ritual, it's important to be consistent. So, making small changes consistently can hopefully lead to, better outcomes over time with your sleep.
Okay. Okay. Here's another one. I have a child who refuses to sleep. I know they need it, but they just won't. My child's 7. What can I do to help?
Again, so yeah, I think it really comes back to sleep hygiene, looking at, the picture where we saw how much sleep our child needs. And then again, really looking at the rituals and the routines that you're putting your child in before bed. So really thinking about what are they doing right before bed? Are they watching television? Are they eating something that is, not putting them in a good place for good sleep? Is it too sugary? Do they have to go to the bathroom? Did they drink too much? So really looking at some of the things that your child is doing before bedtime may help. And then also, I think even just talking about sleep. So just like we may talk to ourselves when we're engaging in our sleep routine, being more mindful. So for example, I'm putting on my pajamas now. I'm going to brush my teeth. I'm going to have a good night's sleep. So some of those things we can actually say out loud to ourselves, but also to our children, to really, educate them and tell them the importance of getting to sleep. And again, as I said in my last answer, consistency is so important. So to make any sort of changes, it's really important to be consistent. So you may do something and say, well, I tried it for 2 days and it didn't work. I would encourage people to really push past that and see if they can continue for a couple of weeks to see if they can make some changes.
That makes sense. Here's another one. Um, what's the optimal nap time to not impact night sleep?
So generally, from what I researched, was about 20 to 40 minutes. Anything over 40 minutes to an hour, certainly 2 hours, can definitely impact your nighttime sleep. And again, it's also the timing of that nap. So you really want to try to have your nap earlier in the afternoon, so that it doesn't interfere with your nighttime sleep.
Okay. This is an interesting one. Can I die from not sleeping enough? Sometimes I have such poor sleep, I worry I'll literally shut down and die. Could that happen? To clarify, I do sleep, but sometimes I can't sleep at night, and then I get worried that I'll die.
Yeah, so I think again it goes back to that image of the reasons why we can't sleep. So it's sort of that cycle of feelings of worrying and feelings of dying that can then perpetuate that cycle of sleep deprivation. So really looking at ways that you can work on your mental health if it is causing you to have some significant thoughts of fear of dying, or something bad happening. It may be worthwhile to seek some mental health support. Talking to your doctor or to a therapist might be important in order to help, gain control of some of those negative thoughts that you're having at night. As I mentioned before, it's not until we lie down that we really are more aware of the thoughts that we have that are going on in our mind. And a lot of those thoughts can be very negative and dysfunctional. And so learning ways to better able to control those thoughts, manage those thoughts, can certainly help to put us in a better, state for sleep. But certainly when they get to a point where we can't manage, I would suggest speaking to a professional.
That makes sense. You talked about a sleep debt. Does that mean that I can make up a shortage of sleep by sleeping more on other days? In other words, can I continue to be a zombie during the week and then make up that sleep on the weekends, or does it really need to be? Because you said also about consistency. Does it need to be more consistent over time?
Yeah, so definitely, like with many things, sleep, in order to improve sleep, consistency is definitely key. So when we talk about sleep debt, it's one of those things where we can't sort of pay off this debt and be back into, we're at baseline. If it does happen for a long period of time, we will start to see those negative consequences of poor sleep. And so, I mentioned earlier as well, like some of us may think that we can function with less sleep, like 4 to 5 hours of sleep. And it also goes back to the life situation that you're in. If you're a student, if you're a new parent to a newborn, you're not getting that sleep. But the effects of sleep deprivation, whether they're short-term or long-term, they don't necessarily go away. So if you're not sleeping for several months at a time, except on the weekends, you can still definitely have some of those long-term risk factors that can really impact your mental and physical health.
Okay, so that sleep debt is really more like a student loan that never goes away then.
Exactly, yeah.
Okay. Um, if consistency in sleep schedule is important, does that mean sleeping in is bad?
So I wouldn't necessarily say that anything is bad, but again, consistency. So if you find that, you're sleeping until noon every day, and you're staying up late and you're engaging in behaviors that don't put you to bed on time, it's something to evaluate. So it really depends on your lifestyle. If you feel like sleeping at until noon suits your lifestyle, then that and it works, then great. But for many people that isn't necessarily optimal or practical for us to do. So certainly sleeping in once in a while is okay if you had something the night before, or if your child didn't sleep the night before. But again, consistency. So really looking at how much sleep you need, what time you want to wake up, and then work backwards and make sure you get to sleep at that time consistently every day. But of course, with making any sort of changes to our routine or our sleep hygiene, it's important to allow yourself those days where things just don't go as planned. And that's perfectly fine, as long as you kind of try to get back on routine the next day.
Okay. I was looking after my granddaughter for a week and I tried all the things that you mentioned, but they didn't work. In fact, I'm the one who went to sleep. Do you have some tips for, it sounds like for grandmothers who are trying to help sleep train or keep their, grandkids consistent? Because I'm sure there's changing of environments and things like that that make it a little bit more challenging. Do you have any tips there?
Yeah, definitely. So again, I think it goes back to consistency. So especially if the child is switching environments, you want to see if there's ways that you can make it consistent. So one that might even involve communicating with the grandparent in terms of the child's sleep schedule. What are some of the things that the child needs before bed that they're doing at home that would help them to do at the grandparents' house as well? So if they're engaging in a song or a story, try to do the same thing at the grandparents' house so that it triggers the child to say, oh, this is my time to go to bed. Maybe wearing the same set of pajamas or taking the same stuffed animal. But again, it all goes back to that sleep routine and that sleep hygiene, and really making sure that there's consistency between the two homes that the child is going to, and educating the child, really being more mindful about the activity of going to bed. So, verbally saying, now we're going to put our pajamas on, let's sing our bedtime song, let's go brush our teeth, and using the exact same phrases between the parent and the grandparent can hopefully help set the child up for better sleep.
It's interesting as you're talking, it occurs to me that we spend so much time on sleep hygiene with children and helping them to learn how to sleep. And then it sounds like we kind of forget about that until we get into adulthood. And a lot of the things that we did, when we were kids, we actually could use when we're adults, the benefit of those things that you mentioned in that kind of wheel of all the different things that can be useful to a good sleep.
Right. It is so interesting because a lot of the things that we would do for a child may work for us. So, even talking to ourselves, saying, I'm putting on my pajamas, I'm going to brush my teeth, or, it's that consistency of engaging in the same ritual every day, drawing your curtains, setting your clothes up for the next day, whatever it is that kind of triggers your mind to know that it's time for bed. Even as adults, it's just as important.
That makes sense. Okay. Um, there's one last question here. Can you explain brisk sleep?
Brisk sleep.
Hmm.
I've never heard that. I'm not sure if that's like a power nap, or I haven't heard of that.
Yeah, it does sound like a power nap.
So
Um,
if it is a power nap that the person is referring to, it again would go back to the naps and really, trying to keep your sleep in a short amount of time so that it doesn't impact your nighttime sleep. I'm not sure if that's what the person is referring to.
okay, okay, that makes sense. Well, Karima, thank you so much. There was clearly a lot of engagement on this topic. People are curious, and everyone's looking to kind of um, find a way to have better sleep, no doubt, for different reasons. So really appreciate you taking the time today to talk to us all about this. I wanted to just remind everybody that you can contact us at admin@silmmentalhealth.com, admin@silmmentalhealth.com, if you do have any concerns or there's something you want to know on the topic of sleep, or you're wanting to work on your sleep hygiene, or some of the things that Karima mentioned could get in the way around anxiety, or feeling down, or just having a lot of things creeping up in that vulnerable state before sleep. Feel free to reach out to us at admin@silmmentalhealth.com. Okay. Thank you all so much for coming.
Thanks, everyone.